Welcome to the compliance tip from the American Institute of Healthcare Compliance. Today's tip is 36415 for venipuncture and related financial risk. The content of this tip is not considered as legal or consulting advice, so please contact your payer for additional billing and documentation requirements. The AMA's CPT code 36415 is defined as a collection of venous blood by venipuncture. Now, it sounds simple and doesn't involve a lot of reimbursement, right? But how often does your organization code and bill and get reimbursed for this? And why is this an area of measure potential risk? Is your office billing 36415 when the patient was actually sent to the referral lab instead? That would be inappropriate, but it could be happening. And did you know that the referral lab could be inappropriately billing 36415 when you are sending them the specimen? Insurance companies have done investigations, and when they see a 36415 billed by two different providers, that can trigger an audit and investigation of overpayment. When the provider has the documentation that they can produce to the payer, then that provider wins. The other suffers risk of being charged with abusive billing practices or even fraud. The CMS Medicare Claims Processing Manual 100-04, and it's specifically Chapter 16, Section 60.1, provides requirements for specimen collection. And what it states is, this fee will not be paid to anyone who has not extracted the specimen. So you've got to remember that you have to have proof. And what's the proof? In the documentation. So we have to have proof that the specimen was drawn at the provider's office and then sent to the laboratory, and that has to be documented in the patient's chart. And when a payer such as Medicare comes along to audit through, for instance, the CERT program, or a ZPIC is probing you during an investigation and they see lack of appropriate documentation of 36415, that can have a huge financial impact upon discovery of overpayment when extrapolation is applied. This is due to the large number of times this code is typically billed and paid. When one of your providers has seen the patient prior to the assistant performing the venipuncture and then instructs the assistant to perform the venipuncture, collect the specimen for the lab tests, the billing is the same, regardless of whether the physician or the assistant actually performs the service based on Incident to guidelines. And this is specific to Medicare. So it doesn't matter if the doctor did it themselves or they instructed the assistant to do it. The same level of documentation is required. So let's talk about mitigating risk. For 36415 to be payable, there must be an order for lab work requiring venipuncture on or prior to the date that 36415 is being billed. That documentation of the order needs to be in the patient's chart. The venipuncture must be documented in the medical record. And remember, if it isn't documented, it didn't happen. And if it didn't happen, you can't bill and get reimbursed for it. So remember, make sure that the physician's order and the performance of the venipuncture are documented, and it has to be signed off or authenticated. You need to make sure you're getting the right code on the claim as well. Venipuncture coding is described using CPT 36415. Don't append modifier 63. Even the CPT book instructs that the use of modifier 63 is inappropriate with this code. Always report 1 unit on the claim form per episode of care. Regardless of how many times the venipuncture is performed, you're going to bill 1 unit on that patient for that day. And that comes with instructions from the National Correct Coding Initiative. 2 or more collections of venous blood by venipuncture during the same episode of care is just not reportable. You can only report 1 unit. So let's talk about auditing tips. 36415 is what I call low-hanging fruit for an insurance company. They can grab onto it. It's usually easy to find that it isn't properly documented, and they can end up recouping a lot of money. Audit and monitor appropriate payer documentation guidelines and verify that the treating provider has ordered the lab work requiring a phlebotomy. Verify that the phlebotomist is at the expense of the practice and all other incident to requires are met. Audit and monitor to ensure 36415 is only billed when the specimen is collected and sent to the referral lab, and make sure you have a tracking system in place for timely lab test results. If the laboratory tests that are ordered are not considered medically necessary, then the phlebotomy is not going to be considered medically necessary. And part of medical necessity for lab, there has to be an order, and then the test results have to be reviewed by the doctor and documentation that those test results were used in the plan of care, even if they were negative. So the ordering provider should review all test results that should be evident in the patient's medical record, and then that helps to support and justify the 36415. Learn more about coding, documentation, and compliance. Consider becoming a certified healthcare auditor and enroll in our Auditing for Compliance online course, which has an option to certify. Cost of certification is included in your tuition. Visit our website at aihc-assn.org or give us a call if you have any questions. We'd love to talk to you.